Getting back to normal as quickly and safely as possible.
Right now, 3 out of the 4 COVID-19 vaccine trials are on temporary holds due to safety concerns. However, Pfizer says it could be ready by November. Week News reporter Veronica Marshall explains why experts say a vaccine doesn't mean things will go back to normal right away.
Johnson & Johnson's coronavirus vaccine trials paused. Eli Lilly's vaccine trials paused. And here in the U.S., AstraZeneca's trials, you guessed it, paused. And yet,
we will need vaccines. And there is hope that by the end of this year, we may have a vaccine.
Fueling some of that hope, Pfizer's claim that it could apply for emergency use authorization for its coronavirus vaccine as early as November. But researchers call that timeline optimistic.
I would be very surprised if they were ready for an EUA by November. If you read the scientific papers, a reasonable timeline for that seems to be early next year.
They'll often be a whole year off in terms of their, when they put a timeline up and they say, oh, we're going to have this new test going to be FDA approved in 6 months. It's usually not for another 18 months, for example.
And even when the drug makers come out with a vaccine, don't expect life to return to normal immediately.
Months and months and months into 2021 or even beyond, we may not be able to, in every section of the country, have uninhibited theaters that are just completely packed, sports events where the spectators are crowded.
Veronica Marshall, Wink News Now.
The administration says it may have up to 100 million doses of the vaccine available by the end of the year. Also, the White House is partnering with Walgreens and CVS to provide vaccines to long-term care facilities at no extra charge.
Everybody's hoping that it's sooner rather than later, but everybody wants it to be safe as well.
And it's going to be such a huge undertaking.
Yeah.